Well, let's bring him in. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. Joe, good morning, my friend. What do you have for us today?
Hey, Ray. I don't remember a time I've gotten so many texts and emails about an issue, and it seems that a lot of people really are thrown by this issue of the Achilles tendon injury. So I had to dig into it a little bit more. We've talked about it a fair bit this year already because it's so common, but a couple of other things we learned and points I want to make. You know, through the years, I've mentioned a lot that a lot of people come to me and say, oh my gosh, a lot of sports is really about the sports medicine aspect and the injury aspect. And there is definitely some truth to that. I mean, if we look at how much it greatly influences winners and losers in just this NBA series, hey, gosh, it looked like maybe the Cavs were favorites, and then they get some injuries, and particularly a significant injury to Darius Garland. And then, hey, the Celtics look like they're going to repeat, and then they get a significant injury to their star Jason Tatum, and then it really affected Game 7. People hunkered down to watch a Game 7 that should have been a very interesting game, but when Halliburton went down, that really tipped the scales in one direction, and it wasn't quite the game that people thought it would be. So injuries play a big role, but an injury that really has everybody scratching their head that I want to touch on today is the Achilles tendon rupture. And I probably got a couple of texts this week about the study from the NBA. From 1990 to 2020, there's about 1.3 Achilles tendon ruptures a year over that 30-year period. There have been 8 Achilles tendon ruptures just this year alone, and that number continues to be increasing. And so a lot of people are really scratching their head about this. And with a career in sports medicine, I always kind of thought and wondered, will we reach a point where we start to surpass the limits of speed and size and strength of these athletes, where just the body really struggles to hold up to that explosive movement, and the explosive movement with speed, size, and strength down around the area of the heel really affects the calf muscle, which attaches to the Achilles tendon, which attaches to the heel bone. And so we've been seeing these, especially in sports that are explosive sports like basketball and football at the highest level. And so, I mean, we know all the names. And actually, some of the other great athletes, Usain Bolt, David Beckham, Deshaun Watson ×2, Kobe Bryant, Kevin Durant, Aaron Rodgers, Kirk Cousins in the last couple of years. But this year, in such a short period, Jason Tatum, Tyrese Halliburton, and Damian Lillard, wow, significant. We also know, and this has been well studied, that the rate of return to high-level sports when you've ruptured your Achilles is about 70%. 60 to 90% is the long-term studies show that you will be able to return to high-level sport. But the problem is most people really feel, and I talk to a lot of experts, that a lot of people that really return at a reduced performance. Performance is a little hard to measure, but things like pain and decreased strength and stiffness in that area of the calf, and it really leads to shortened careers. There's no doubt, and evidence shows, shortening the careers of these athletes. So what a major problem. What are we going to do about it? And so one of the real pioneers and a great researcher and physical therapist had a study in 2024. There's a lot of people really interested about this issue. They could look at Tim Hewitt's study. Tim's been all over the place, most notably down at University of Cincinnati, came out with a study in 2024 about Achilles. But what he raised really, right at the beginning of the article, is two major questions. Are we now at an unacceptable level of Achilles tendon ruptures for the sports of basketball and football? And number two, what are the causes of why that would be? But this week, in thinking about this issue a lot and looking at a lot at it, and I've been in the field 40-plus years, I would add a third question to that, Ray, and that is, can we do anything in the field of sports medicine to look at achieving some reducing this problem and prevention of this problem? We've done this before. We've done this with ACLs to a modest extent. We've done this with concussions. problems with concussion. We've reduced concussions. But with all these really smart people, sports medicine doctors and orthopedists and physical therapists and trainers and nutritionists, can we look at prevention? And four different areas that I think we could look at. Preventative rehab programs, equipment, footwear, or other types of equipment that could reduce the stress to the Achilles complex and the calf complex. Number three is, could we treat these injuries more aggressively early on so they don't go on to scar tissue, partial tears, and then complete tears? Could we do anything about the playing surface? Tim Hewitt talked about in the NFL trying to look at things at the playing surface. And so looking at many different ways, is there anything nutritionally we could do to prevent these injuries? So I really think I challenge the sports medicine community throughout the country with this injury that really has people very frustrated for the effect that it has on sports. Is there something that we can do to try to prevent these Achilles tendon ruptures?
Yeah, you're seeing a lot of them, unfortunately, and I think you're right. The size and of these athletes getting bigger and bigger and more stress on those Achilles, but it's certainly puzzling, Joe.
Yeah, no doubt about it. And a lot of people did grab me this week and say, hey, weekend warrior athletes get these too. I've been through this. And you know, we get into that age range that you and I have been to and maybe through even, is this happens quite a bit in weekend warriors. But this effect, particularly from my background of sports medicine, is concerning. 1.3 per year, and we've had 8 this year alone. A real major effect, and it's time to call in the sports medicine team to kind of huddle up here and say, is there anything we can do to prevent and reduce these injuries?
I agree. Joe, as always, my friend, thanks for the time and the insight, and we'll see if we can get some answers to those questions on down the line. Thanks, Joe.
Thanks, Ray. Have a great week.